Hello students, welcome to the channel. I'm the OGGuru Dr. Punit Bhojani and we are here for the recently FMGE recall session. Now, these are all the recall MCQs which I have got from the help of the students, and as you can see the smile on my face and so many students, thank you for all your love and appreciation. I can see the messages coming in that yes, overall paper was slightly tricky, but OBGY was made very easy thanks to sir your video lectures and the rapid revision MVP MCQs. I request all of you, those who are preparing now for the December FMG session, please download the OGGuru app, and there's a 6 months package where I'm personally guiding the students. You will get timetable, guidance, entire theory lecture, rapid revision MCQ, beautiful handwritten notes, mock test, everything will be there. And 6 months package is available at an extremely low cost. Launch 30 is the discount coupon. So all the students going in for the December FMG examination can subscribe to the 6 months package. You all will surely benefit. So let us begin this session. And this session will try to give you not only the answers, I'll try to also give you the little bit of explanation so that all those preparing for the upcoming FMG exam will also get benefit from this lectures. Okay, let us begin. The first question, yes. Now please understand, directly do not mark. I had again discussed this question that MTP as per the latest guideline is allowed till 24 weeks of gestation, but please read the indication over here. Here the indication given to us is for failure of contraception. So 20 to 24 week, what change has been done in the new MTP Act was for special cases like if the fetal anomaly is detected late, or sexual assault or rape victim, or mother life is at risk. Here remember, for failure of contraception it is still only till 20 weeks. So many times in my lectures, also in the rapid revision MCQ also, and in the marathon session also, we had discussed this point that up to 20 weeks only, because if your contraception has failed, condom has ruptured and the patient is pregnant, you can't be sitting at home for 24 weeks. Okay, so remember, for failure of contraception it is still only up to 20 weeks. Please keep this in mind, and again this is surely likely to be repeated also in the future. So up to 24 weeks is the new guidelines, but for failure of contraception we are only still going to follow 20 weeks only is the limit. Okay, and all of you know that now as per the latest, when the pregnancy is up to 20 weeks, okay, up to 20 weeks, only one doctor, okay, only one doctor or one RMP has to certify, okay, certify, or the opinion, as they say, opinion of one doctor. And after 24 weeks, okay, after beyond 20 weeks, now more than 20 weeks, then two doctor opinion or signature has to be done. Okay, is this understood to all of you? Yes, so please keep in mind this point also. Moving on to the next MCQ. Yes, now please understand student that directly you read BP high and proteinuria present not present and you mark preeclampsia. No, please understand, here the patient is 17 weeks. Some student told me question paper was given 12 weeks, some student told me 17 weeks. Whatever it is, please understand that all of you know that preeclampsia is only after 20 weeks of gestation, and similarly even gestational hypertension also. So both gestational hypertension and preeclampsia, both gestational hypertension and preeclampsia are only after 20 weeks of gestation. Chronic hypertension becomes the answer over here because the patient is 12 weeks or 17 weeks. Okay, so either what is chronic hypertension, sir? Either the blood pressure is high before pregnancy, if before pregnancy the blood pressure is high, or if the blood pressure is high before 20 weeks of gestation. And there's one more definition which we also teach in our lectures, that after delivery of a patient, even after 12 weeks postpartum, the BP does not return back to normal. So this patient who was 12 weeks or 17 weeks, BP high 150, 100, and we cut off value is, all of you know, more than 140 by 90. Okay, so this is chronic hypertension and not preeclampsia or gestational hypertension. Okay, and the difference between, just by the way, gestational hypertension, preeclampsia difference is that in gestational hypertension there is no proteinuria, preeclampsia is high blood pressure plus proteinuria, but after 20 weeks. Okay, So I hope all of you must have got this correct. Moving on, yes, again, very easy. Post-coital contraception, that is your emergency contraception. And so many times we have discussed I-pill is the brand name. I-pill or unwanted. Brand name we may not remember, but what it is, single tablet of LNG 1.5 milligram. Okay, this is effective up to 72 hours. Okay, so up to 72 hours following sexual activity. And what does this contain? Yes, LNG single tablet 1.5 milligram. Okay, what should be given? This is what is to be given. Estrogen, progesterone in high doses. We don't follow. Anybody, what is this called? It is outdated because it causes a lot of nausea, vomiting. So this is called as USP method. Okay, USP method, where we give high doses of ocipils. Okay, high doses of ocipils are given. That is not very popular, no longer used. Okay, so LNG 1.5 milligram single tablet, which is by the brand name of iPill or unwanted 72. Brand names we are not supposed to remember. I'm just telling you so that you just remember it in the exam. Okay, but up to 72 hours. And also do not forget, what have I taught you? One of the latest and the newer, anybody, new emergency contraception. Yes, selective progesterone receptor modulator, Ulipristal. Clap, thoko tali. Okay, so this is all the extra information which we are giving you. Ulipristal can also be used as an emergency contraception. Okay, moving on to the next. Yes, again, so happy. You can see the smile on my face. Okay, that vacuum. Okay, ventus is another name for vacuum. Okay, so in the vacuum chapter we have discussed that, of course, sir, heart disease we give. Heart disease is not a contraindication. Heart disease may, why do we give? I don't want the mother to do that bearing down effort. So in heart disease, I would like to cut short the second stage of labor, either by applying a forceps or a vacuum. Both can be applied. Okay, any one of them can be applied. So yes, in heart disease, and mother is not bearing down or mother exhaustion, and of course the last indication is also fetal distress for the instrumental. In fact, I had also given a prediction reel. There's a prediction video. In that also I said that remember the contraindications for vacuum. I'm so happy that even the prediction video has come out to be true. And yes, prematurity is a absolute contraindication. Why? Because the preterm babies are anyway more prone to intraventricular hemorrhage, and with the vacuum or ventus is going to be increased risk of intraventricular hemorrhage. Okay, so when the pregnancy is less than 34 weeks, so if the question is 32, 33, 34 weeks, we do not apply vacuum. So vacuum application is contraindicated in prematurity or preterm. No confusion, no controversy. This is the answer, because there is an increased risk of intraventricular hemorrhage. Okay, heart disease patients, in fact, we apply in heart disease to cut short second stage forceps or vacuum should be applied. Okay, so I hope all of you must have got this correct. Moving on to the, yes, again, simple marker for ectopic pregnancy. By marker they mean that what is detected, and yes, beta HCG. But keep in mind what one more important point about this is that we check in ectopic pregnancy, we check for the doubling time. Okay, and what is done is we are checking that we repeat the beta HCG after 48 hours. So you do one value, we do one value, and after 48 hours we repeat. Okay, and normally there is doubling indicates a normal healthy intrauterine pregnancy. Okay, so if the level is 1000 and it becomes, so if the level of initial value is 1000 and then after 48 hours the level become 2000, it is indicating a normal healthy intrauterine pregnancy. Okay, because in early pregnancy the beta HCG doubles every 48 hours. But what happens is that if the level is only 1000 initially, and after 48 hours if the level is only 1200 or 1300, that is kuch to gadbad hai daya. Okay, to gadbad hai, and this is suggestive of एक्टॉपिक प्रेगनेंसी, यस और नो बेटा? ओके, सो ये भी हमने हमारे लेक्चर में बताया था, बीटा HCG कैडर्स रूल है, एंड एक्टॉपिक प्रेगनेंसी में डबलिंग नहीं होता है। ओके, सो इन नॉर्मल हेल्दी प्रेगनेंसी, इन स्पेसिफिकली इंट्रायूट्राइन में HCG डबल हो जाता है। ओके, मूविंग ऑन टू द नेक्स्ट MCQ। यस, आई एम सो हैप्पी, ये भी हमने हमारे लेक्चर में बताया था कि सिंपल बात है, क्या है, हेड हैज डिलीवर्ड। ओके, सो हेड डिलीवर हो जाता है, द हेड, and what happens is that yes, after the delivery of the head, and then head recoils and hits the perineum. Why? Because the shoulder, this is the pubic symphysis, and the shoulder has got stuck behind the pubic symphysis, which is our shoulder dystocia. Shoulder dystocia का definition ही यहाँ से शुरू होता है। Okay, please understand, cephalopelvic disproportion में even the head will not deliver, okay, because CPD है, head will not deliver, okay, in CPD अगर cephalopelvic disproportion है, so head only will not deliver। यहाँ पे head has delivered, दो चीज था कि some students told me कि sir rest of the baby not getting delivered, ये थोड़ा सा difficult MCQ। shoulder got stuck अगर question paper में है तो simple हो गया। ओके, सो यू ऑल्सो कमेंट इन द चैट बॉक्स एग्जैक्टली क्या था, वेदर हेड डिलीवरी के बाद रेस्ट ऑफ द बेबी वाज नॉट गेटिंग डिलीवर्ड, ये पूछा था, या रेस्ट शोल्डर हैज गॉट स्टक, शोल्डर गॉट स्टक दिया है तो ब्लाइंडली शोल्डर डिस्टोर्शन। ओके, एंड दिस व्हाट हैपेंस इज हेड रिकॉइल्स। ओके, जैसे हेड बाहर आ रहा है, सडनली हेड रिकॉइल्स, इसको क्या बोलते हैं? क्लैप इफ यू फील हैप्पी। यस, वर्जिन MCQ, फ्यूचर में आएगा टर्टल साइन। ओके, सो दिस इज योर टर्टल साइन दैट द हेड suddenly coming out and head recoils and hits against the perineum. All the maneuvers also we have discussed in our lectures. So please download the OGGuru app and do not waste your time, and फटाफट दिसंबर का प्रिपरेशन शुरू कर दो। What is gone, just install the app and get in touch with me, and 6 months package all of you can subscribe for the December FMG। Okay, so the clinical case very important, likely to be repeated in the future। Okay, moving on। Yes, I'm sure सबने ये करेक्ट किया होगा। This is a Lippi's loop। Okay, this is outdated first generation IUCD। Okay, first generation Lippi's loop, you can see like a loop। Okay, multi load हमने हमारे वीडियो में दिखाया था। multi load, what I have told you? Yes, okay, multi load is appearing like a sunrise। Okay, so ऐसा 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 ऐसा, that is the multi load device। Myrina also so many times in my rapid revision recall, and also Myrina is completely white device, and copper T380 is one which is having a copper wire even on the horizontal arms। Okay, so if you get a picture like this and copper wire is there, not only wound like this but also on the horizontal T, that is your copper T380, that is the longest acting। Okay, so ये question outdated था, अकॉर्डिंग टू मी नहीं पूछना चाहिए था, बट वेरी स्ट्रेट फॉरवर्ड। आई एम श्योर सबको करेक्ट होगा। हमने इंस्टाग्राम पे भी ये वी हैड पुट दिस इन द वन ऑफ द इमेजेस। ओके, यस, मूविंग ऑन टू द नेक्स्ट क्वेश्चन। Yes, now outlet force. Now again, इसमें थोड़ा सा I got 2-3 variations. If the question was that at what station I should apply the forceps, then remember station should be minimum +2। Okay, station should be at least +2 overall for me to apply the forceps। Okay, keep this in mind। Okay, and all of you quickly know what is the meaning of station. Station is the relation of the fetal head and the maternal spine। Ischial spine is considered station 0। So mother का ischial spine, and compulsory for station I have to do a PV examination। PV पे ही we get to know about the station। Okay, so 1 centimeter down, +1 +2 +3 +4 +5। Okay, so बाकी जो भी है, when the station is 0, that is outdated kachra dustbin, mid cavity forceps, okay, mid cavity. And when the station is in negative, let's say -2, -3, okay, all that is high forceps, all that we don't apply. So when the station is in negative, -2, -3, all that is high forceps. Minimum, okay, +2, +2 is a low forceps. ओके, सो अगेन प्लीज इसमें देखना क्वेश्चन क्या था. अगर लो फोर्सेप्स पूछा था, फॉर लो फोर्सेप्स इट इज +2. okay, low forceps, station 0 attitude. And in station more than, when the head stretches the vulval outlet, and then when I apply the forceps, that is the outlet forceps. So यहाँ पे the station like +4, +5, at least more than +3. okay, so this is the head on perineum है. Basically the scalp is visible at the okay, so when the scalp is visible at the introitus, okay, fetal scalp, okay, visible at the introitus, जिसको okay we also call head on perineum, and that is almost station तब तक +3, +4, +5 हो जाएगा. So please read the question correctly. Minimum station should be at least +2. that is also called as low forceps. outlet उसके बाद और नीचे. So अगर +4, +5 ऑप्शन में है तो वो head on perineum है, तो वो okay is the answer. Moving on to the next MCQ. Yes, it's a radiotherapy kind of an MCQ. What happens is that I have told you for stage 2B onwards, okay, stage 2B to 4, okay, stage up the modified radical hysterectomy stage 1A to 1B 2A तक होता है. So after stage 2B, stage 3, 3A, 3B of cervical cancer, and stage 4A, 4B, they become inoperable and they have to be treated with radiotherapy only. Nowadays we follow CTRT, which is your concurrent chemoradiation. Okay, concurrent chemoradiation. So in this radiotherapy, 2 types का होता है. टेलीथेरेपी जहाँ पे हम रेडिएशन दूर से देते हैं. ब्रैकीथेरेपी where a radioactive material in the form of tandem and ovoids, okay, so ovoids बोलते हैं उसको. Your radiology teacher will of course cover this, but that is for cervical cancer. okay, अगर आपको ये भी पता था कि ओवेरियन कैंसर में तो आई यूज कीमोथेरेपी. yes, again in my lecture we have discussed कि surgery followed by we give chemotherapy. okay, we give only chemotherapy. okay, and choriocarcinoma also again we give imaco or methotrexate. okay, so again that is only chemotherapy. okay, so you know कि tandem where we give, it's when we give a radiation नजदीक से, brachytherapy basically. okay, so cervical. So even if you look at other options, आपको ये आ जाता. ovoids and tandems where a radioactive material is inserted inside the vagina, that is for cervical cancer. okay, moving on to the simplest MCQ. I think सबको पता है, neural tube defect, what is the vitamin folic acid, and yes, periconceptional. okay, so nothing much to discuss. ये भी हमने बताया था, doses के साथ periconceptional folic acid is given. okay, and everybody should get at least 400 microgram per day. So periconceptional folic acid for prevention of neural tube defect. okay, so I hope all of you have got this correct. Yes, again very straightforward. Spotting. So now whenever it's a foreign body, so yes, after few days spotting is expected. So you don't remove it immediately. okay, we don't remove it. We don't need to give antibiotic as such afterwards also. So just we need to reassure the patient, we need to observe, yes, and just give reassurance to the patient and ask for follow-up, close follow-up, and see how it is. okay, if when do I remove? If it's a persistent, okay, persistent, if there is, because initially there's also menorrhagia expected initially for few months, but if it's a persistent menorrhagia or dysmenorrhea and severe, because generally the body gets adjusted. okay, so menorrhagia and dysmenorrhea also, menorrhagia, dysmenorrhea, which is a known side effect, generally settles. okay, so initially also अगर menorrhagia, dysmenorrhea होता है, so we can just reassurance, give tranexamic acid is what we give. okay, tranexamic acid we give, meftazpad, any painkiller we give. okay, here तो only spotting पूछा है. okay, but if it's a persistent and then we can think of removal of the IUD. Okay, so if it's a persistent menorrhagia, dysmenorrhea, discomfort, then yes, we'll have to remove it and try some other method of birth control. Just थोड़ा सा spotting हुआ है, best is just observe, reassure the patient that it is going to settle down, and tranexamic acid painkiller can be given, and just follow up for the patient. Okay, now yes, again I'm so happy. Cord clamping पे 2 question था. Please understand what we do. Early cord clamping was the old concept. Okay, that early cord clamping, no, nowadays what we follow is a delayed cord clamping as long as the baby is active. Okay, so delayed cord clamping is nowadays followed, and therefore the answer is yes, 1 to 3 minutes or 2 to 3 minutes. Okay, so 2 to 3 minutes is generally what we do, delayed cord clamping. And remember, यहाँ पे और एक question डिस्कस करेंगे कि when we go for early and which cases all we follow delayed. So it's almost all cases including preterm delayed cord clamping is followed, which is 1 to 3 minutes. Okay, so I hope this also most of you have got it correct, I'm sure. Okay, yes, Bartholin cyst. Okay, so Bartholin cyst kaisa hota hai? The location at the vaginal orifice, it is the duct opens at the junction, okay, in the groove between the labia minora and the hymen at the junction of anterior 2/3 and posterior 1/3. Okay, so at the junction of, that is also, if you have seen the picture also in image based question, वहीं पे generally होता है. So anterior 2/3 and posterior 1/3 is the location. Here is the junction. So here is where it is. So location is the not medial and not lateral and not anterior 1/3. Okay, so at the junction of, obviously posterior 1/3 है तो anterior 2/3 ही होगा. So at the junction of this, here is the gland which is located. Okay, and the duct also opens into the groove between the labia minora and the hymen. So it is the anterior 2/3 and posterior 1/3. And remember 2 things, student, for the upcoming exam. Many students have a doubt कि sir क्या करेंगे treatment. So please understand, if they tell you it is an abscess, then for abscess the treatment is incision and drainage, IND. Okay, IND, incision and drainage is to be done if it's a abscess. But if it is a cyst, then the treatment is marsupialization of the cyst. Okay, so don't get confused. Again, 2 separate MCQs: Bartholin cyst, marsupialization of the cyst. But Bartholin's abscess, of course antibiotics and incision and drainage. And one more, how will I know in the clinical scenario? Yes, if they tell you patient comes to us with a painless swelling. Okay, if they tell you it is a painless swelling at the junction of same anterior 2/3, posterior 1/3, okay, or upper 2/3 and lower 1/3, okay, then it is a painless swelling, then you mark it as cyst. But if they tell you that the patient is having a tender swelling, okay, and there is of course pain and difficulty in walking, fever, ये सब signs of inflammation are given, then it's an abscess. Okay, so they tell you tender swelling, painful swelling, fever, then it is incision and drainage. So ये फ्यूचर के लिए आ सकता है क्वेश्चन. सो पेनलेस स्वेलिंग, बार्थोलिन cyst, marsupialization of the cyst. Okay, yes, again we have told you that any patient who is in the reproductive age group, okay, reproductive age group, and comes to us with irregular vaginal bleeding, yes, we should first do a urine pregnancy test or a serum beta HCG to rule out any pregnancy, because all your early pregnancy complication, okay, early pregnancy complication like your threatened abortion or even your ectopic pregnancy or incomplete abortion will have irregular bleeding pattern. Okay, so always remember that any patient who comes to us in reproductive age group with any kind of abnormal uterine bleeding, yes, we need to rule out pregnancy first by doing UPT, and then of course, yes, after that I would do a transvaginal sonography preferred, transabdominal. Pap smear of course would be done as a routine, not the next best. PAP is just for screening. Okay, post coital bola hai, if you see there's a routine screening, then PAP. but initially always pregnancy needs to be ruled out in any lady with irregular bleeding. The reason is that pregnancy complication, okay, pregnancy complication can present with your irregular bleeding. Okay, yes. Now again, yes, so what is this topic? Vaginal birth after cesarean or trial of scar. Okay, so I'm so happy that we have discussed this, including the criteria that can I do it for previous 3 LSCS? Sorry sir, I cannot do it in previous 3 LSCS, trial of scar. Okay, is it clear? And similarly, in previous classical cesarean section also I cannot give trial of scar. And when we are doing LSCS, what is the rupture rate of the scar? Yes, 0.2 to 0.9%. I told you, remember, max 1%, isn't it? आपको याद रखना है कि under less than 1%, 0.2 to 0.9, so 0.5. This is the rupture rate of LSCS, okay, lower segment. Okay, lower segment. So the risk of rupture is not 4 to 9%. 4 to 9%, 4 to is for the classical cesarean, okay, and that's why in classical cesarean and in lower vertical the rupture rates are higher. But yes, as I told you, whenever we are doing VBAC, emergency LSCS facility of course has to be there, because you need to tell the patient के pelvis is adequate and मैं हूं ना. Remember मैंने कहा था कि मैं हूं ना, मैं मतलब मेरा पूरा team, operation theater, anesthetist, C-section facility should be there. Then only we can think of VBAC or trial of scar. Okay, so VBAC or trial of scar के लिए, and one more thing, pelvis should be adequate. Yes, pelvis should be adequate. There should be no CPD. Okay, and only for previous one. Okay, pelvis adequate and emergency LSCS facility should be there. Okay, rupture rates, remember, for LSCS less than 1%. Okay, 0.2 to 0.9, जिसको exact numbers याद रखना है. Okay, moving on to the next. Yes, again very simple, banana sign, lemon sign is all you know. न्यूरल ट्यूब डिफेक्ट, डाउन सिंड्रोम के बहुत सारे साइंस हमने आपको बताए थे. आई टोल्ड यू अबाउट द इंट्राकार्डियक फोकस एंड इंक्रीज इन एनटी and all that, increase nuchal translucency, but that is not this. And anencephaly में frog eyes, and you cannot miss out. Anencephaly is the earliest. Okay, remember student, if they ask you earliest anomaly, okay, earliest anomaly to be detected on USG as early as even 10 weeks. Okay, so earliest anomaly to be detected on ultrasonography, anencephaly. Neural tube defect, banana sign, lemon sign, both are seen. Okay, is this understood to all of you? Moving on, postpartum IUCD, we can do it even immediate. Okay, so remember I told you this, immediate PPIUs, that is your PPIUCD. Government of India is promoting this. Immediately after delivery we can do the postpartum IUCD, even following a vaginal delivery also, even in case of LSCS also, but can be done up to first 48 hours. Okay, so up to 48 hours we can do it, and then if not, then after 6 weeks. Okay, so immediate PPIUCD, that is postpartum IUCD, can be done at the time of delivery only, while suturing the episiotomy. Vaginal delivery में कर सकते हैं. LSCS at the time of insertion. Okay, at the time of the incision and suturing के पहले we can put the IUCD and close the uterus. Okay, so immediately on OT table also, and immediately following vaginal delivery, PPIUCD up to 48 hours. Okay, moving on. Now please understand this. Okay, early cord clamping कब करते हैं? Okay, so old answer, preterm was the old concept. Okay, and many students know, in latest, even in preterm baby, if the baby is vigorous, okay, vigorous is the word used. Okay, vigorous, or if the baby is active, then even on preterm babies we now follow only delayed cord clamping. सो ये ओल्ड कॉन्सेप्ट था कि इन प्री टर्म वी डोंट डू दिस. दिस इज द लेटेस्ट थिंग एंड आई टोल्ड यू इन माय लेक्चर्स, ओके, कि इवन इन प्री टर्म बेबीज we are following delayed cord clamping. And please understand, not only Rh negative, just if the mother is Rh negative, nahi, Rh isoimmunization. Okay, in Rh isoimmunization, that means when the antibodies, because that means what, when the antibodies are already present, when the antibodies are present, there we prefer a early cord clamping, because this antibodies will cause more fetal hemolysis, isn't it? सो डोंट गेट कंफ्यूज. यस, ये थोड़ा सा ट्रिकी एमसीक्यू था, काफ़ी स्टूडेंट ने आर एच नेगेटिव मार्क किया होगा, बट जस्ट इफ इट इज आर एच नेगेटिव ने कॉमन सेंस नॉन विगरस. अभी अगेन इसमें मुझे बताना ऑप्शंस क्या था. नॉन विगरस बेबी or if any fetal distress, basically when I need to immediately give the baby to the pediatrician. Okay, so fetal distress अगर दिया है, okay students, fetal distress दिया है तो भी we go for early cord clamping. And even if suppose it's a meconium stained amniotic fluid also, and basically wherever the early intervention is required, so fetal distress or basically wherever, yes, a fetal resuscitation is required. Okay, so fetal distress, baby has not cried, that means it's a non-vigorous baby, then I give early cord clamping and hand over the baby to the pediatrician. So preterm may we can follow delayed cord clamping as long as the baby is active, and Rh negative is not the thing. It should have been Rh isoimmunization, because the antibodies will cause more fetal hemolysis if I go for delayed cord clamping, and therefore Rh isoimmunization we go for early cord clamp. But not only just if Rh negative mother hai, nahi. Yes, again I'm so happy. Go back and check my cervical cancer video, and the opening statement ही यही है कि cervical cancer is the most common genital malignancy. Okay, it is the most common genital malignancy, but overall remember now, because of the vaccination and pap smear, cervical cancer slightly going down, and breast cancer is the number one cancer for ladies in India today. So most common cancer for ladies in India is breast cancer. Cervical cancer becomes the second most common. So I hope this is of course a surgery MCQ and also gynec MCQ. So cervical cancer is the second most common cancer, but genital malignancy पूछा होता तो cervical cancer definitely answer होता, because breast is not a part of genital system. Overall most common cancer, breast cancer number 1, cervical cancer number 2. Okay, now moving on to the next MCQ. And yes, I am so happy. मैंने क्या बताया था, Leafoot's operation is only for postmenopausal lady where we suture off. It's called Leafoot surgery. Yes or no? And nulli gravida patient, third degree prolapse, why we don't do Fothergill also हमने बताया था, because sir Fothergill will cause lot of complications. Yes sir, it will cause cervical incompetence. Okay, again in the PYQ I have discussed this. Okay, cervical incompetence हो जाता है, या even cervical stenosis होता है, infertility हो सकता है. So this patient is nulliparous. She wants to have babies in the future. So Fothergill surgery will lead to cervical incompetence, repeated abortion, infertility. So we don't do. And what is our dictum? Yes sir, मैंने क्या कहा था, Sing is king. Okay, many years back Akshay Kumar movie had come, Sing is king, and that is what I had told all of you to remember, okay, Sling is king. Okay, Sing is king, and you will remember Sling is king. Okay, and therefore abdominal sling surgery. Now again remember this, Shirodkar is a part of a sling. So agar ye same options hai, thoda sa they should have specified, but of course sling surgery is the answer. स्लिंग में 3 टाइप के होते हैं. अगेन एज आई हैव टोल्ड यू, वी कैन गेट पुरंदरे स्लिंग, शिरोडकर स्लिंग also you get, and Khanna sling. And from Mumbai, Dr. Virkud So Virkud sling. But name of this you're not supposed to remember. But Purandare sling, Shirodkar sling, Khanna sling, Virkud sling. 4 sling surgery names I'm giving you. All are done through the abdominal route. Shirodkar ka, we have got Shirodkar encerclage also, and Shirodkar uterosacral advancement. Okay, this is one of the surgery, very rarely done. Shirodkar uterosacral advancement, that is done for prolapse, but again in nulliparous patient, the dictum jo humne kaha tha, sing is king, sling is king, is what you need to remember. Okay, so can all of you get me the confirmed options whether both C and D were there? And thoda sa it becomes unfair for the student, but then D is still the best answer because Shirodkar, what they have not spent. Shirodkar ka there is a encerclage also for os incompetence. Shirodkar uterosacral advancement is also there, and Shirodkar sling is also there. So abdominal sling surgery, which is Purandare or Khanna or Virkud, sling is king, sling is the best. Okay, so and yes, I think these were all the questions from which we could remember. And if of course if something is there, you can also get always please WhatsApp me and we can get back to you. And radioactive tandem ka yes maine bata diya, CA cervix tha, so most of these are covered. And this, I hope all of you had a great time, and do not forget to download the OGGuru app, and all of you can please get in touch with me with any of the doubts you have got regarding the package. And definitely please go in for the 6-month subscription, and do follow me on Insta also. Do subscribe to the YouTube channel. Wishing you all the best for all your upcoming examinations. Thank you for your love and appreciation. Do share this video with all your friends and colleagues, and do stay in touch with me, and I'll be there to help you and guide you. Best of luck.